acute respiratory distress syndrome, shortly called ARDS, also called acute lung injury ALI, or diffuse alveolar damage DAD. Now, the name itself suggests that it has something to do with this alveolar damage. Means everything is starting with this alveolar damage. So let's take a look at a normal alveoli. This is a normal alveoli. And the lining of this alveoli is type 1 pneumocyte and type 2 pneumocyte. And this type 2 pneumocyte release surfactant. And for the capillary, the lining is endothelial cells. Now, this endothelial cell is very important. Why? Because this alveolar damage starts with this endothelial cell. And the first step is endothelial cell activation. And the reason can be sepsis, viral infection, gastric aspiration, trauma, or pancreatitis. Now, as there is endothelial cell activation, this neutrophil will come and attach here. And as this neutrophil adhere here, it will cause endothelial damage. This endothelial will be damaged. And as this endothelial is damaged, it will start leaking blood out. And it will go to the alveoli also, causing non-cardiogenic pulmonary edema. Remember, it is non-cardiogenic pulmonary edema. And seeing all this blood, now macrophages will be attracted here. Okay, so macrophages are activated, and this macrophage will release TNF alpha and interleukin 8. And this interleukin 8 will have one major function, that is, they will allow these neutrophils to come in this alveoli. They will recruit these neutrophils, and these neutrophils will release toxic materials like protease and free radicals. And these free radicals and proteases will damage the endothelial lining of alveoli. Means it will damage pneumocyte 1 and pneumocyte 2. And the pneumocyte type 1 is having function of gas exchange. That means there will be no gas exchange now. And the type 2 pneumocyte has function of releasing surfactant. That means if the surfactant is decreased now, there will be alveoli collapse. And as this alveoli collapse, there will be accumulation of every necrotic cells, cellular debris, edema fluid, clogged bronchial epithelium, hyaline membrane, everything, fibrin, everything will be accumulated in this, and it will give a appearance like this. Here you can see hyaline membrane. This is hyaline membrane disease, and the treatment for this can be treating the underlying cause, or even we have to give mechanical ventilation with positive and expiratory pressure. Many patients may not survive after this, and if they survive, chronic lung injury will happen.
Thanks for watching. Don't forget to like and subscribe and share with your friends.